and she ended up living in a memory care facility, and there were actually caregivers there as well. So, and then eventually she did pass away, unfortunately. But several years later, when I realized, we have one life, right? And I really wanted to make an impact. And although I felt that I was really helping people in my physician role, it was something that after all those years, I was inspired by my mom's experience, and I just decided to take a leap and try it. And it's been rewarding, challenging, and I think it's great that I can use some of my previous skills to help people in a different way. And so, and we're all, we all have different challenges as we go through our life journey. And I think as I've gotten older, it's given me a perspective that's able to, help people a little more than in my younger years. Yeah.
Awesome. Thank you, Dave. So I'm going to go ahead
Yeah.
and give you the power. So you're going to go
All
ahead
right.
and see the make host. There you
Okay.
go. Power is
All right.
yours. If
All
anybody
right.
does enter that waiting room, just click admit. But
Okay.
otherwise, screen is yours, sir.
Okay, great. Let me just pull this up, and can everyone see okay?
We are good.
Um, I guess yeah, I'll just assume that we can see. Okay, so again, thank you, Aaron, for having me here. Hopefully this will be informative. And again, if there's questions, we'll have some opportunity at the end or even during, if there's something you really, want to maybe not forget about, then I'm happy to answer as we go along. So, as I said, I was a physician. I'm still board certified and currently licensed as a physician, and so I keep everything current. But that's just a little background about me. My specialty, by the way, was obstetrics and gynecology. But before that, I actually was involved with neurologic research in after college, and so I did do some research into Parkinson's as well as um, multiple sclerosis and stroke and seizures. So anyhow, just a little bit about me. So just to give you kind of an overview before we get into some of the details, since this is about how home care versus facility care can be helpful with Parkinson's patients and family members. But one of the key benefits of non-medical home care is that it's specialized care to the unique needs of the person who has it. And so this can involve several different aspects, including mobility and fall prevention assistance. And obviously for Parkinson's patients, because balance and mobility can be a challenge, and falls can be a result of that. A caregiver can help with walking and transferring and making sure the environment is safe so that there isn't an accidental fall as things, in some cases, progress. Um, we can also do things such as medication reminders and monitoring because sometimes the medication schedules, depending on what you might be taking, can be confusing or complex. Then missing a dose could make a difference in your life and your functions. And so caregivers can do reminders for that, and also just support with daily activities, things such as dressing, bathing, meal prep, allowing you to live a normal life, and or to help out the person that is your family caregiver. And then finally, emotional and social engagement, that can be just as critical because having a chronic illness can cause depression in some cases. And so this gives an opportunity to have someone else who can help in that regard. So before really getting into what some of the details of home care can involve, but just when do you recognize, like how to recognize when you might need it? In some cases, it might be obvious, but maybe those out there might be wondering, well, is this something that we can just handle on our own or want to handle on our own? So deciding when to seek home care can be challenging, and it can be emotional because you're bringing someone else into your world that you may not even know initially. So, but one of the first things would be increased difficulty with daily tasks, and this is a key indicator. Things like dressing, bathing, or making meals may become, overwhelming in some cases, might lead to frustration, and so this can sometimes lead to maybe not even eating like you would normally. Another red flag might be frequent falls or mobility issues because of the impact of Parkinson's on balance and coordination, and so this can lead to injuries. And next would be having a family caregiver kind of get burned out. Obviously we're all human, and despite our love for each other, sometimes it's just human to get overwhelmed and sometimes needing a little bit of a break to refreshen ourselves. And so, especially if you're doing it full time, and so this can be physical, emotional, and lead to mental exhaustion. So, having a caregiver in that case can help you revitalize yourself so that you're more available for the rest of the time that you're with your loved one. And then symptom progression that might require specialized care, and that can be another sign. So, as in many cases, Parkinson's worsens, then the symptoms can be more complex and might benefit from having a trained caregiver that can help with some of those. And and then finally, if your actual neurologist or other healthcare professional recommends a caregiver, then that would be a sign that they see that you really are in need of some extra help, and they may be able to suggest a caregiver or an agency or someone that can be a resource for you. So, okay. And so I've described some situations, but sometimes just putting it in the context of an example can be helpful. So these are just kind of typical situations. So we'll just give you an example here. We have Miss J. She's 78 years old, a female, and she began having frequent falls and was starting to struggle with things like dressing. And so her family noticed that she wasn't taking her medications. So they decided, okay, let's have a caregiver come in to help her remember to take her medications and to help with some of her mobility assistance at home so that she can avoid falling. Um, and then the next example would be Mr. T, 65, with a more advanced form of Parkinson's. His wife was taking care of him, but then over time, it was really starting to become very difficult physically and emotionally. And so fortunately, they recognized that this was like a form of burnout, and so they reached out and found a home care aide to help to give her some relief, and so she was able to get that relief. And then finally, the example of a doctor. Uh, the neurologist typically would recognize the impact this is having on someone's life and their family's life, and so making that referral for home care help can definitely help in that situation. So just some examples to put it into context. So qualities of an exceptional home care agency. So obviously, with any service level um, provider, there are several commonalities, things that you want to review to make sure that you're going to get someone who's helpful and also safe. Um, and foremost is helping you in the way you need help. So you want to have someone experienced. So experienced caregivers with Parkinson specific training, which is ideal. So this means they understand the challenges of Parkinson's, especially with the mobility, tremors, and medication schedules. Next would be customized care plans. So one size doesn't fit all, and that especially is true with Parkinson's patients. And so uh, when you speak with someone who provides home care, if you call an agency, one of the things that will happen is to have a personal kind of an interview where a care plan is formed that's very specific to your needs. And so this is essential. And that's how the care can be optimal for your particular situation. And then, of course, one of the other things that's very important, especially with trust, is transparency. So clear communication about what the services are that you'll get, how much they cost, how is the care actually delivered, and so that's very crucial. And you can also do this, especially nowadays with social media, Google searching. Look for positive reviews and recommendations. So that can be through online research, or if you have friends, maybe through this network, someone who used a particular caregiver or caregiver agency. Personal referrals are definitely something you can typically depend on, at least for an initial visit or discussion. Okay. So the other thing, so validating the family's journey. So these are common things that happen, and sometimes we do obviously want to focus on the person that does have Parkinson's, but we don't want to forget about the impact that it can have on others. And it's just these are things that are kind of obvious, but I always like to just point them out just to um, you know that we appreciate everyone who's helping in particular family situation. And so the the some of the physical symptoms can be difficult, and then effects on mood, and then the practical things like swallowing or speech, difficulty sleeping, the medication schedules, and so these are things that I always like to remind ourselves with of. I mean, okay. So let's just say you've decided that you think that the time might be right to look into a caregiver that might be able to help your situation. And so there's some different things you want to look into when you do the search. First, you definitely want to interview potential agencies. Not just jump in. There can be differences, but ask about their experience, especially with Parkinson's care. And if you have any questions, don't be afraid to dig into the details. That's what agents are there to provide, the service that you need. Ask them about their training. How did they match their caregivers with you? Is there a process? Hopefully it's not just random. And any agency that is what I consider, higher quality will not have any problems with answering these questions. These are very legitimate and very important. Next would be to just verify that their caregivers are screened and trained. You can ask for documentation, or you can look online, especially in California here, where I'm assuming most of us would be doing this in California. The state actually has a registry for caregivers, and you can find out if a caregiver is actually registered with the state of California, and that ensures that they've gone through the correct background checks and are essentially legitimate in the eyes of California. And
Uh, Dave, quick question.
mhm,
At some point during this presentation, would you mind giving us either the link or the name of the California state registration that you just mentioned? And then
yeah, sure.
two, what is an example of a valid training process? Meaning that if people were saying, "Oh, I'd like to know what kind of training you have," what are some key things that an agency
Yeah.
would be saying to help us understand what sort of Parkinson specific training they've gone through?
Yeah, so that's a good question. So one would be based on so a lot of caregivers actually have medical backgrounds, either as in the form of some form of a nursing level, such as a licensed vocational nurse or a nursing assistant, or even registered nurse in some cases. But even if they don't, some have actually worked in settings where Parkinson's patients are present, in especially like inpatient settings or in facilities such as nursing homes or um, skilled nursing facilities, and so that they have in-house training in that sense. And then there's also training that the caregiving agencies can provide, which is largely knowledge based because part of knowing how to help someone with Parkinson's is knowing to anticipate what are their difficulties going to be. And so we have different, like, so in the case of my agency, Griswold, we have like online training courses which are specifically geared for caregivers that we pay for, so that they have the specific knowledge base, so that they know what is involved. We actually do this with several different medical conditions, not just Parkinson's. We do this for Alzheimer's and things such as that. So, but those would be two different ways of kind of verifying that they have some type of training in it. And the longer that someone's been a caregiver, the more likely that they've had recurrent training also, because in the state of California, there's a requirement to have a certain number of hours per year, regardless of how many years you've been a caregiver. And so the number of years, as well as, and you can find proof of training if you ask the agency, they can provide a certificate of completion. Um, and if you really wanted to dig deep, you could probably ask for references, even though we've gone through that process with them. Sometimes, people may want to take that extra step, but I'll admit that that's pretty rare because we've done the footwork for you, and that's one of the benefits of working with someone like us or any other agency that is licensed in California. Yeah.
Awesome. Thank
So
you.
yeah, um, and I can give you that link for the caregiver search. I can put it in the chat here at the end.
Perfect.
Yeah. And so yeah, so verifying, screening, and training processes, and then by going to the website, you can confirm that the agency is hiring a registered caregiver. Now, a licensed agency that is keeping up with things has to by law. You cannot hire a caregiver who's not registered. But certainly you can do your due diligence. That's never a bad thing. And of course, the agency should be licensed. And surprisingly, I'm involved with the Home Care Association of America lobbying group in California to advocate for home care agencies as well as home care clients to ensure safety. And I was surprised to hear that there's an estimated 1,200 agencies operating in California that are unlicensed. So that means they just set up shop and then just start putting out solicitations for, for business. And you can find these things like on Craigslist and or Facebook Marketplace. And so if you're not, you guys are now very knowledgeable about some of the foundations of caregiving agencies, and so if you weren't though, you might not know to investigate and look into this. So now some of those agencies, they might be good. It's just that you just can't tell because they haven't gone through that process um, of applying and being vetted, background checked. So just something to think about. And also, although this really is never an issue, um, as a licensed home care agency, everyone needs to be insured and bonded. And so that's for your safety. And in case something were to happen, you'd know that you would be protected. So, all right. Um, the financial side of home care, this is true of anything related to health, obviously. It's a reality. And so I just like to cover this briefly just to, so the different options that you might be confronted with. Basically, these are the different methods that typically people will pay for home care. Private pay obviously works for many people, but long-term care insurance is another option. And although they're less common these days, some people do have policies, and there are actually companies are still writing policies. So this is something, if you have long-term care insurance, may be helpful. Um, there are also state-related benefits through Medicaid. There are Medicaid waivers that will cover it, and this really all depend on your particular financial situation. But that's another thing. And some people that own, they may own real estate or something, and that may be a vehicle that works for them. That's something that you can work with, someone that's in financing. And sometimes people will ask us about this, but um, it's just another option for some people. And so it's just something to keep in mind. So just kind of in summary, if you, when you're out there looking, a trusted agency, you want to make sure that obviously they're compassionate and they're really centered around your needs, right? It's very specific, and everything that's discussed really should be around what you need and how your needs will best be served. Making sure that they have ongoing training and that they're consistent, you can depend on them, and then looking for positive reviews and references. And I think if you can satisfy most or of all of those, you'll be happy. So I just wanted to cover something briefly here. I spoke about non-medical home care. The other thing that sometimes people are faced with is whether to go into more of a facility or assisted living type of situation. For some people, that ends up being something that is needed or maybe desired. And so we'll talk about this briefly. But basically, non-medical home care, as we discussed, is where the support is provided in your own home. And for many, that's a place they've lived in for many decades, and so there's value and benefit to that. For others, though, assisted living can be helpful, a structured living environment with access to care and community. And so we'll go through briefly some differences. So again, non-medical home care is personalized support at home. Caregivers assist with daily activities like bathing and other personal care, and you're in a familiar environment and just where you've been for many years, and that might be what you're really looking for. Um, what are the pros of non-medical home care? So, one, you're in a familiar environment, so you reduce the chances of confusion, anxiety. We know that in some cases, when people go to a new, like a facility, assisted living home, it can lead to depression. And so, but not for everybody. For some people, it's actually works. So it's just something to keep in mind when you're in this decision-making process eventually. But at home, you also get the one-on-one personalized care from a caregiver. That caregiver is there for you and only you. The schedules are flexible, and so depending on your situation, you can arrange basically the time of day, the day of the week that you want to have some interaction with the caregiver. And so, all right. And what are the cons? So some of the challenges, as with anything in life, costs can increase if you need, especially if you need someone around the clock, and that's where the cost could become something to consider. Um, if you need safety modifications in your home. So some homes are very well equipped, or it's easy to install things like grab bars or modifying showers. But in some situations, either for personal or financial reasons, that may not be a practical option. And so being at home may not be the greatest option. And then when you're at home, social isolation, that could still be an issue. If just being with one other person uh, isn't really something that satisfies that need that many have, then that may be considered a con. So what is assisted living? So assisted living offers a more structured environment, and that might be helpful, especially if someone needs a little more oversight and support. You can live in a private or a shared situation, depending on the community. There's on-site staff, and so that's going to be more than just one person. And these could be a wide variety of types of providers, anywhere from an actual licensed healthcare provider like a nurse to someone who's just trained on the job, and even caregivers actually. Assisted living often hire their own caregivers or bring people in. There could be social activity access, meals in a community setting, and then the 24/7 care and support potentially. So those are some of the pros. So access to staff, social interaction. No need to really modify your home because they're already set up like that. And what are some of the cons? So it may seem like less personalized care in some situations because there are a lot of people there. Not a lot necessarily, but more than just yourself. And so this can be something that maybe feel a little less personalized depending on the place that you are at. And initially, it might feel a little disorienting. This is a new place, and so depending on the individual, if you're highly adaptable and it doesn't really phase you, then great. But if someone's used to being in their home for 40 years and suddenly you're in this unfamiliar environment, that can be unsettling for some. And again, depending on the location, expense can be a preventive prohibition to being in a assisted living facility as well. So it's something else to consider. So here's just a simple table that kind of gives a comparison and contrast. So kind of in summary here, what you should consider with either of these options is going to be the level of care. Do you need full-time versus occasional or a few times a week? Comfort and familiarity with home versus going to a new place. Um, are you highly independent or kind of like to be in a social environment? And of course, cost. And then, how much family involvement. Some people don't really have family, unfortunately, and so they're more limited. But many people have a great support network, and sometimes being at home is the optimal. Okay. Okay, just have a little like a 2-minute quiz for fun. Okay, so here's 5 questions. They're true, false. So you almost can't go wrong with this. So Dave Penney. Well, okay, I didn't read this at the beginning, but maybe if somebody saw it. Dave Penney has over 25 years of experience as a board certified physician and a certified senior advisor. Answer. Oh, I
Yeah,
guess I guess thumbs up is
I
true,
was just
right?
gonna say, yeah, we're all on mute, so I guess we're all we're giving
Okay.
you a thumbs up.
Okay. Okay. Yeah. Okay. Yes. True. That is true. Over 25 years of experience, board certified and certified senior advisor. All right. Next. True or false? Non-medical home care for Parkinson's patients does not include emotional or social engagements as part of the care plan. Non-medical home care does not include. Okay. I know it's kind of a negative question, but and yes, false. Correct. That is correct. False. Non-medical home care does include emotional and social engagement as part of the care plan. Um, in fact, that's true for almost everyone that's getting non-medical home care, even with other conditions. So, Okay, true or false? Payment options for non-medical home care can include private pay, long-term care insurance, using real estate assets like reverse mortgages. Answer is okay. See some thumb. Yep, true. All right, run a roll. I made this too easy, No, I think you guys are just good listeners. Okay, true or false? Recognizing caregiver burnout or frequent falls in a loved one with Parkinson's can indicate it's time to seek home care support. All right, true. All right, awesome. Um, all right, well, let's see. Um, I put together the screen to have so you can have a place to go for resources in case you want to delve into some of these areas. The most important one is going to be the one at the bottom. It's I spelled it out for you. It's called linktr.ee and then slash home care info. That's basically a link that has a lots of resources on it that is kind of like a one-stop shop. I actually put Parkinson's Orange County on it, and it's called a link tree. So if you go to that, you'll see Parkinson's Orange County, and then you may know people that have other conditions such as Alzheimer's. And this is just a screenshot of the screen, but I just give that as an option for convenience. And then that's just for me. So thank you for inviting me, and I hope this was helpful. And if there's any questions, I'm here, and I'll give it to Erin.
Oh my gosh, Dave, I'm giving you, and I think we're all giving you a virtual round of applause. Thank
Oh,
you.
yes,
Thank you for
thank
such an
you.
awesome presentation. There are two requests from you that I would love. One,
Sure.
if you could copy paste that link tree link into the
Okay.
chat so we have it.
Oh,
And
yeah.
thank you so much for
Yes.
personalizing it. I feel such like a rock star. Parkinson's Orange County has their own link to all of the resources you just chatted about. So thank
Yes.
you. So
Yes.
one, copy paste that link in the chat for us if you don't mind.
Yep. I'll do
And
that.
then two, yeah, follow up on that resource on the registry for anybody who's certified in home care. That would be helpful for us as well.
Sure. Let me see if I can do that on the go here on the fly.
No worries. So Dave, while you're doing that, why don't you go ahead and actually stop your screen share? So
Okay.
and you
Yeah.
if you feel comfortable. Oh, there it is. Yeah, thank you. And
Okay.
yeah, and if you feel comfortable, you can always make me host again, and I can make sure that you are not bothered by anybody trying to come
I'll
into that waiting room.
Yeah, let me do that real quickly here.
Sure, no
Okay.
problem.
Make host.
Now,
There you
well,
go.
thank you. Dave, thank you so much. And all of that information, remember, the session is being recorded. All this information will be available to you, and Dave will not only link it right here, I'll follow up with an email based on our conversations today with the information he provided, the video recording of this session, as well as any links that he had. So, yeah, whether you get it from our chat bar, from my weekly newsletter, or from just an email follow-up, you've got my resources, I promise. But I wanted to go ahead and actually open up the floor. And if you want to ask a question, all you need to do is go to that little corner of your little box. You can see either your name or the video of you. And in the corner of that box, it's going to say unmute. And you're just going to unmute yourself and go ahead and jump in. Does anybody have any questions for Dave based on the presentation?
I have a comment. I don't know if it's as much a question. I get phone calls on a regular basis, people looking for caregivers and they talk about the isolation that's happening at home. And just one thing that I mention to people, and I don't know if your staff does this or not, Dave, but just they'll say, well, dad doesn't know how to use the computer. Because I'll say, does he have access to a computer? Does he know how to use Zoom? Because there are so many resources available on the computer. They can attend support groups and exercise
Hmm.
classes and things like that. And I say, well, if you do have someone come into the home, they can help them get on Zoom. And maybe they
Yeah.
can do an online exercise class with the caregiver next to them. So just in case they have
Yeah.
balance issues or something like that, it can open up a huge world to them, just being able to use that.
Yeah, we do. So when we develop our care plan for each of our clients, one of the things that we figure out is if they're interested in something like that that requires some technology, that when we do our caregiver matching, we pick a caregiver who's very good at that type of thing. And most people are pretty good actually, just because that's the way, the world is these days. But we make sure, and so that way we can, get them to go to that area or do the exercises. Um, there's such a wide variety of different things that the caregivers can help with, actually, even aside from that. But that's a good example of a very specific detail. Yeah.
And just one other thing I wanted to ask about, you kept saying non-medical home care, and is
Yeah.
that specifically not giving medications? Is that the big thing?
Yeah, so that's a good question. So yeah, there's non-medical home care, and then there's home health. And so they sound very similar, but they're very different. So home health would be anything that involves injecting, breaking of the skin, whether that be injecting a medication, anything that's invasive, such as a catheter management, like inserting a catheter in someone, or taking care of an open wound. And when I mean taking care, I don't mean like putting a Band-Aid on it, but like cleaning it and dressing it in a way that a licensed professional has to do, and that would be typically like a nurse. So that's home health. Everything else falls under the non-medical home care. So that would be, if you can imagine, if you're a family member helping out your someone in your family, generally speaking, any kind of what we would call like unskilled help, even though it's a skill, but in the medical context, it's unskilled, could fall under non-medical home care. So, activities of daily living like dressing, bathing, helping cook, even mobility monitoring. So if somebody's using a walker or a cane, or just a little unsteady on their own, to be there ready to give them some balance or assistance, helping them transfer, doing errands, even driving to doctor's appointments or the grocery store or out to eat. Those all fall under non-medical. So home health is very specific. Injecting the skin, breaking of the skin, invasive or wound care is
So
home health.
non-medical, they can give medication, or can they just give the reminder?
So you can just give the reminder. Technically, you can't administer it. That's just, it's a very, and there's a lot of reasons behind that, but basically, yeah, it has to do with it's just because technically, if they put the wrong thing in, then that would be a medical issue. Yeah, but it's the home care aide or home caregiver can look at the bottle, and so knows, okay, that's the bottle. You just can't physically put it inside the person.
So Dave, the maybe a clarifying question is, I know it's the technical term is non-medical, but a non-medical aid can still bring the bottle and a glass of water and provide that as assistance. They just can't physically administer it to the patient, correct?
Correct.
Okay, yeah. So
Yeah,
so essentially
absolutely.
they can help with medical needs, they just can't administer it.
Correct. They just can't administer it. It's that contact that kind of makes the distinction. Yeah. Um, I'll just, yeah.
Thank you for the clarification.
Sure.
So Dave, there was a question that came up in the chat. This is from Peter, from Deidre and Peter, actually. And it says, thank you so very much for this session. Are they paid? I assume they mean caregivers. Are they paid by the hour? And I assume a minimum of hours per day.
Generally speaking, caregivers are paid by the hour. There are certain situations where there's a certain block of time that would be paid for instead of by the hour, or if someone is doing overnight care. But generally speaking, it's by the hour, and the minimum number of hours of day. No, it really depends on the agency and the caregiver. Now, I would say that. Um, Most agencies and caregivers will work a minimum number of hours, though. So even though it's not a requirement, but that's just by virtue of when you have lots of different possible clients, it's really difficult to go for like an hour or two, and so generally because of that, they would have a minimum number. It might be three, it might be four, but like I said, there could be a caregiver out there or an agency that would say, okay, we'll be fine with an hour. It's just not something that is very common in my experience.
And Dave, as a clarifying question, do you find that most agencies have, say, a set minimum of two or four or standard blocks, say from 8 to 12 or 1 to 5, versus every single care agency is completely different and there's just no standard set across the board?
I mean, there's two types of scheduling. Some agencies do like block scheduling, not in terms of the number of hours, but just when during the day. So like a 7 to 12 would be a block, and then somewhere in that time would be your care, and then the next one would be from, let's say, noon to 4. And so, going into the middle of that block, they may not be as open to that because they want to efficiently put their caregivers into as many places as possible. And so by going in between blocks, that would really make that difficult. So that's one way of scheduling. And then the other way is what we do, which is we just schedule throughout the day, all dependent on the needs of the family. So whether it's from 11 to 2 or 12 to 4, it doesn't, that's not part of how we schedule. It gives us the maximum amount of flexibility by doing that. Yeah.
Thank you.
Sure.
Other questions? Feel free to unmute yourself or even type them into the chat bar.
Is there a going rate, an hourly rate?
Yeah, it really it varies very, very widely. But I would say the lowest that I've seen for an agency in the Orange County area is $25 an hour. And I was surprised by that actually, but that would be that would be the lowest I've ever seen. And it can go up from there. And I would say that on the high end would be over $40 an hour. And really that all depends on the type of care that's given, the agency, the caregiver. Um, in Orange County, though, the typical rate of an agency is somewhere in the 30s, anywhere from $30 an hour to $40 an hour. That would be a very common rate. Yeah.
Dave, I have been on the side of it where I'm the family member hiring an agency 24/7, and at those rates, it's very, very expensive to do 24/7. I
It
know
is.
there are charitable organizations that help us pay for medications. Do
Mhm.
you know of any organizations at all that help the family pay for these home care expenses?
Yeah, so I don't have any personal relationships with any, but I do know one of my best resources, and you're probably already familiar with them, is the Office on Aging in Orange County, and that's been my go-to when I'm seeking some information for things like that, because they're much more in touch with the broader array of needs, and so um, that would be my go-to to be in, to network to find some of those. Yeah.
Okay.
Real quick, that again,
Office on Aging. Here, let me see if I can.
on
I'll grab you
aging.
the.
Oh, okay. I thought
Yep,
that
on Aging.
agency, aging. Okay, got it.
Oh, I'm sorry.
That's okay.
Yeah,
I just wanted
I
to
have.
I was going, oh, cool. Oh, good.
Yep,
Yeah,
I just wrote it into the chat, but you can certainly
Perfect.
find the link, Dave. It's the Orange County Office of Aging.
Okay, perfect.
And
Yeah.
although I don't have the direct links that on supplemental support, oh, thank you, Dave.
He's got it.
He knows all the things. Thanks. Yes, he put the link into the chat bar. And so, yeah, you can certainly explore that and let's look for some additional resources. Because, Dave, it sounds like even with Griswold, you offer an incredible service, but I know for so many of us on especially
Yes.
limited or fixed fund budgets, it's
Yes.
hard. And I know you gave us
Yeah.
some really helpful options on, say, like reverse mortgages or looking for supplemental life long-term care insurance. But yeah, I think a lot of us, we're all in the same bucket of like, how do we make our dollars stretch, but also the quality of care work for
Sure.
us?
Yes. Let me just send you the other link that you asked me about before I run out of time here. Um, the last link is the one to look up a home care aides registry, and you do need to have their registry ID, which a home care agency should be willing to give that to you because that's public information, and there's nothing identifying about the number, and so if you're talking with an agency and they have you set up, or they talk about a caregiver they've set up with you, if you want you can look them up just ask for their registry ID number, and that link is where you can enter it on that page, and it'll show them.
Thank
Yeah.
you.
Oh, I'm sorry. One thing I didn't mention regarding paying for home care, if anyone is a veteran, if they served at least 2 years in the military, um, some agencies are authorized Veterans Administration providers. There is a VA benefit for home care services, and so our main contact is the Long Beach Veterans Administration. They kind of cover this entire area for home care needs, and so we partner with them, and we've gone through a vetting process with their organization to make sure that we can provide services for veterans. So if anybody is a veteran here, or if you know anyone that's looking for home care, that would be another option. They do pay for a certain amount of hours depending on what they feel is authorized, and that can add up to quite a bit of a benefit, actually. So and if you don't know how to, it can be a little, as in a lot of things with the government, it can be a little bit cumbersome to go through the process, but like in our case, we're trained to do that, and so there's a certain steps that you just have to take, and we can help people with those applications.
Dave, that's
So
whether
that's
or
another
not
one.
their disability is service related?
Correct. It doesn't have to be, there doesn't have to be a disability that's service related, and there's no financial need either. It's just purely, do you have a medical condition that requires home care so that you can live at home? And it's beneficial for everyone. For the VA, obviously, there's a cost savings to being at your own home, and for the veteran, you get the benefits of staying in your own home.
And you do the interfacing with the VA, or does the?
Yeah.
Okay.
So we do interfacing. There's a certain amount of interfacing the veteran has to do, just because they have to have a doctor that I can't be the doctor. They have to have a doctor that would just do an evaluation to confirm that they do have a need, and that doctor would submit a form to the VA that would then authorize the need, and then the VA has basically a coordinator that would then send me the authorization, and then I would then coordinate with the veteran to set up the care, like as we would with anyone. So there's some steps and a little bit of interfacing by the veteran, but just to get the authorization at the beginning.
It's good to know.
Yeah.
Information.
Yeah.
Thank you.
Yep, certainly.
Got it. Any additional questions for Dave? Dave, I have a question. Is there any sort of supplement through Medicare that could, any additional Medicare plans or Medicare supplemental plans that cover non-medical home insurance, or is that just not available?
There is a Medicaid waiver, and depending on which Medicaid plan you're on, but you have to be with a credentialed provider for that to apply. And so our agency actually traditionally hasn't been credentialed with Medicare, so we're actually waiting for that right now. It's about a 7-month process, and so hopefully we'll be credentialed in the spring. Yeah, it's pretty backed up. The state of California is backlogged. There's so many things going on. So, but yeah.
Got it.
Mm-hmm.
Any other questions?
And speaking real quick on that Medicaid, just yes or no answer, or lead me in the right direction. How long does it take to get on Medicaid? Do you know?
To get on as a patient?
As a patient.
Oh, that's a good question.
I mean, we need it more for the father-in-law,
Yeah, I don't know what the typical turnaround time. I know from a medical standpoint, in my medical practice, Medicaid in general could be very fast, especially for someone needing quick services.
Yes.
I don't know. But I can't specifically comment about if someone with Parkinson's would be able to get onto it that quickly.
Okay.
Yeah.
Thank you.
Roberta, Yeah, I'm by no means a Medicaid expert, but I have been through the process of review with it. And I do know that here in Orange County, at least, it's through the social services office, and it should be through your local social services office. And
Service.
what, yeah, social services. And what they do is they have a questionnaire that goes through the types of, qualifications for Medicaid. And honestly, they are very quick at turning that around. If they can issue it and you're able to do it, I believe they can turn it around within the month, even quicker in some
Oh,
cases.
okay, because
Yeah.
somehow the two brothers, I mean, my son-in-law and his brother, have this in their mind that, oh, it takes months and months and months and months, and because their father, he just doesn't have anything. So I said months and months. I don't know. We did it in Arizona for my mom. She needed it, and it didn't take that long. But okay, California's different. But okay, that's good to know. So social services office, and he lives in Rancho Santa Margarita anyway, in an apartment, and he can't live by himself anymore. There's just no way. The hospital won't even release him to himself. That's the one thing that they're saying. So I was just curious. So do we go through Rancho Santa Margarita because that's where his address is, or when you say social services office, just OC?
Orange
Oh,
County has a
Orange County.
social services
Okay.
office. It's located right near Laguna Woods.
Oh,
And
good.
it's an easy search online. In fact, I can do it for you while I'm here and certainly send that out. But yeah, their Medicaid screening is very quick.
Oh,
They want proof of your financial,
good.
standing, and I think the only thing that could complicate the process is if you have conflicting information, meaning you report one thing but your taxes say another, and
No, yeah,
things get
no,
things get a
yeah,
little hairy. But
yeah.
if everything lines up and they're able to screen it, they'll turn that around within just a few weeks, a month at
Good
most.
information. Thank you. Thank you
Mhm.
very much.
Lauren, any last questions that you had? Because Dave was so thorough. Dave, you answered all of my questions that I actually had for you, and I'm so grateful for that. But Lauren, did you have any
Oh,
last
good.
questions for Dave?
I don't think so. Dave, I thank you so much for this. Like I have been on the family side of this situation, and often it comes, when there's an emergency, a family member has been put in the hospital or taken a turn for the worse, and you're struggling to find
Yeah.
care providers, and it is so difficult and emotional and all that. So I think to have the information in advance and it just gives you a little bit of power to even know the questions to ask when you call the agency. So I really, really
Yeah. Oh, I'm happy that you got something out of this.
Absolutely. And Dave, I think what
Yeah.
was so important from our perspective, since we, both Lauren and I, get so many questions on in-home care as well as assisted living care, is we finally feel comfortable knowing what to ask for and how to ask for it. We just didn't know where to even start in that process of looking for assisted living or in-home care, or what that even
Yeah.
entailed, but medical versus
Right.
non-medical health, and all of that stuff. So thank you so much for this information.
You're welcome.
All
Happy
right.
we have some. Okay.
Of, of course. Any last questions before we go ahead and end our session with Dave? All right. Well, Dave, we thank you so much for your time. This session was
Yeah.
recorded and it will be available to everyone. In addition, I'll follow up with an email with Dave's information and all of the links that he provided today so that everyone has access to it, including the ones he provided in the chat bar. And if anybody has any additional questions, feel free to email me. It's just the basic info at parkinsonsoc.org. So thank you so much, everybody, for
Thank
coming.
you.
Yes, thank
Okay.
you.
Thank
Dave,
you
thank
very
you for your
much.
Thanks for having me.
time.
It was good meeting
Yes,
everyone.
we appreciate you. All
All
right,
right.
everybody. We'll see you next time. Remember the fourth Thursday of every month.
Thank you.
All
Have a
right,
great day.
Bye.
bye.
Bye-bye.